4 wards at Tan Tock Seng Hospital are now under lockdown as the hospital tries its best to contain and control the spread of COVID-19 infections. All visitors will be barred except for those visiting critically ill patients. The hospital is also casting a wider net beyond the wards. Gwyneth Teo with more.
Staff and patient movements will be highly restricted for the 4 wards under lockdown at Tan Tock Seng Hospital. 3 wards are where a cluster of COVID-19 infections has emerged. The 4th is where a nurse who's been linked to the ICA cluster works. The hospital says a dedicated team of staff will take care of patients in these wards. No one will be allowed in or out, and heightened precautions will be taken if the patients need to go to another department, for example, for an X-ray. No new patients will be admitted to these wards either. So far, 76 employees have been placed on leave of absence awaiting quarantine orders. More are expected to be affected, and that's going to cause a manpower crunch at the hospital.
By the time we finish our full contact tracing, so I do anticipate a couple of hundred will be possibly put on leave of absence. In order to manage our manpower, therefore, we will have to therefore reduce electives. We are reviewing our outpatient clinic schedule as well to reduce the number of appointments. The less urgent appointments will be rescheduled beyond these 2 weeks in order for us to cope by redeploying our manpower to essential areas that require operations. We have also worked with the ministry to look at non-life-threatening ambulance cases coming to our hospital.
All staff and patients have been swabbed in these 4 wards. So far, none have tested positive. The hospital is also casting its net wider by swabbing all 1,100 current inpatients by Friday evening and all 4,500 staff by this weekend. It's also performing surveillance testing on all patients who were discharged on or after 18th of April. Although a nurse was the first identified case of the cluster, the hospital says she may not have been the original case. They're not ruling out that the infection could have been brought in by someone else who has not yet been identified. The multi-ministry task force also addressed the vaccination status of the new cases in this cluster. 4 of the 5 staff had been vaccinated, while 2 patients had received at least the first dose. But still, it says the vaccine has shown to be effective, as most of the cases who were vaccinated either had mild or even no symptoms.
The vaccinations do work. They protect yourself, first of all, from the risk of severe disease, and they do help to reduce transmission. It's not 100%, but there is an impact. And the more of us who are vaccinated, the bigger the impact will be in reducing overall transmission of the virus in our community. So once again, we really encourage everyone who is medically eligible or who are in the age groups to get yourselves vaccinated. Make a booking if you have not done so already.
The Health Ministry is investigating whether the cases are linked to a possible variant of COVID-19, and it says it'll know by next week at the earliest.